Oh, hey guys. So I'm going to be doing my physical head-to-toe assessment on my friend Eric at his house. We're actually at Northwest Community Hospital. But I'm going to use my GoPro and do it in first person because this is a really expensive camera and I never use it. So let's give it a shot. Okay, awesome. So I'm knocking on the door and introducing myself after I wash my hands. Hey, my name's Mike. I'm a Harper College nursing student. Can you tell me your name and date of birth?
Eric Wenzel, 31093.
Excellent. Let's go check your wristband, Eric. Thank you very much. So today I just want to be, I just have a goal, and that's going to be to do a full head-to-toe physical assessment on a patient today. Is that okay with you?
Mm-hmm.
Awesome. And just for clarification purposes, do you know why you're here right now?
Just for general purpose checkup.
Excellent. And do you know today's date?
November 16th.
November 16th. What year? Just kidding.
2017.
You know the year. Anyway, okay, so first things first, we start off with the general assessment. So we just tested his speech and his communication, which was clear, normal rate and rhythm. He's got alert and oriented ×4 consciousness and cognition. He knows where he's at, why he's here, what the date is. And I'm looking at his overall skin color. I don't see anything close to erythema, cyanosis, pallor, or jaundice, but we'll get a little more in depth with that with the extremity test. So also we just did the visual acuity test. So he had a visual acuity of 20/20. We did a BMI after we took his weight and his height. It was around 24. And then we also did some vital signs. So we did blood pressure, which was normal, 120/80. Heart rate was 58. We also did respirations, was 14, and his temperature was 98.7. So everything was perfectly sound and checked up with that. So next we're going to move to inspecting and assessing his head. So we look at the size and the shape. It's normocephalic. We palpate it nice and firm really quick, noting any lumps, masses, tumors possibly, and I don't feel anything there. We're looking at the symmetry of his face. You want to give me a smile? Perfect. So that's cranial nerve number 7. We're also going to be checking the maxillary sinuses. So let me know if there's any pain. No pain?
Nope.
And the frontal sinuses? No pain?
Nope.
And the temporal mandibular joint. So just open your jaw for me, and open and close it a couple times. And I don't feel any clicking or crepitus, no pain with that as well. We're going to move on to the ears. So I'm just doing a quick inspection. I see the meatus, the tragus are all intact. A little bit of red, but it's kind of warm at the hospital. And I'm looking at the auditory canal as well, doing a quick palpation to see if there's any lumps or masses. And then I'm going to test cranial nerve number 8 by doing the whisper test. So just repeat after me, and I'm going to whisper over here.
Blue paper.
That's for the left ear, and for the right ear.
Gray shirt.
Gray shirt. So cranial nerve number 8 is intact. Wonderful. Moving on to the eyes. The first thing I'm going to want to do is look at the sclera and the conjunctiva. Can you just look up at the ceiling? And then I'm going to move down his skin here. And you got to open your eyes real quick too. I'm sorry. I know it's kind of uncomfortable. Sclera are pink and moist. The conjunctiva are pink and moist, and the sclera is white and moist. A little bit of venous structures there. He's probably had some eye strain, been at work all day, I'm sure, and in the hospital, kind of stressed out. And then we're going to run through the test for cranial nerve number 6, 4, and 3. So I'm going to grab my pen. And so this is just going to run through the diagnostic positions test. So just follow my pen, and you do the 6 cardinal positions, and you're seeing the symmetry of each eye and how they follow through. And then the accommodation test, and he's accommodated. And we're also going to check the pupillary reflex. Very, very bright light, guys. I'm sorry I don't have my normal pen light, but Eric's agreed to do it. I've already showed it to him. So it's a little bright, but just look at my finger, and can you cover your right eye for me? And then just look at my finger, and I just need to see the contraction of your pupils, okay?
Mm-hmm.
And they contract, same with his eyelid a little bit, because it's very bright. And left. Awesome, thank you very much. Okay, and just one other thing too, just to talk about visual nerves. The cranial nerve number 2 was for the previous a visual acuity test we did too, and then also the confrontation test too, if you want to go more farther into it. Okay, so after we tested that, we're going to document it as PERLA, so the pupils were equally round and reacted to light, and that they also accommodated. So next we're moving to the nose. So we're looking at the nasolabial folds and the bridge, doing a quick palpation. There's no tenderness. It's not swollen at all, and it doesn't seem to be fractured at all. Can you plug one of your noses, close one of your, and breathe in the other side? So they're patent on both sides. We could also check for devious septums if we wanted to, but we'll move on to the mouth. The lips of the mouth are pink and moist, and I'm also going to have you stick up your tongue for me. Just like that. So it comes down the midline. That's testing cranial nerve number 12. It's not drooping to either side. And if you can just open your mouth wide and say ah, I'll cover your eyes because it's kind of bright. Ah for me. Sorry, it's kind of blinking here. So that tested the, let me get a new light here, I'm sorry. So that was testing, it's running out of battery. That was testing cranial nerve number 9 and 10 for the gag reflex. One more time. Excellent. And I can see the tonsils were +1. The buccal mucosa are pink and moist, a little bit of white from probably just grinding teeth. And then the gums are pink and tight, and the roof of the mouth is also the soft and hard palate are pink and moist, and then there's a lot of pleasant rugae on the tongue. There you go. And then the venous structures on the base of the mouth are present. I don't see any lesions or anything. That's a sign of there could be a breeding ground of cancer on the base of the mouth, floor of the mouth, and that it's also pink and moist as well. Thank you, Eric. So I'm just gonna pause this really quick. So that was the mouth and the throat. Next, I'm gonna want you to, I'm gonna actually move this back here real quick. So we're just gonna check his neck also. So I'm just gonna recline him to 30 to 45 degrees. It's a good time right now to check for venous distension for the jugular vein. If you just look towards that wall, and I'm just seeing if there's any venous distension. I'm not seeing any, and look towards me. Venous distension, I'm not seeing any either. I'm gonna palpate each carotid pulse, left and right, good. And I'm going to give him a quick listen with the bell of my stethoscope to check for any bruise. Excellent. And no bruise. Nice clear sound there. Also, we're taking a look at the glands. So this is a good position for it too. The parotid glands, the salivary glands, and also the thyroid gland. I'm not seeing any bulging out of either of them. We're also going to check the lymph nodes as well. I'm going to palpate them. So there's a couple different lymph nodes you might not have heard of, but you'll hear me recite them. This is the preauricular lymph node, postauricular lymph node right behind there, and then lean your head forward. The occipital lymph node, the posterior cervical lymph node, and then rest your head again. And then we're going to do the submental lymph node, the submandibular lymph nodes, the jugulo-digastric lymph nodes, the superficial cervical lymph nodes, and then the deep cervical chain down the sternocleidomastoid muscle. There we go. Yay, love it. And then I'm going to have you just do that, and then I'm going to feel right in here for the supraclavicular lymph node. And relax your shoulders. For cranial nerve number 11, I'm going to have you lift up your shoulders towards me. Excellent. So the strength was perfect with that. And then also, no, that's actually good. That concludes the neck. Perfect. So I'm going to move on to the upper extremities here. So I'm going to move this forward a little bit. Sorry. I'm looking at the skin color initially, kind of like I did in the beginning. See a tattoo here, but I don't see any abrasions. I don't see any lesions or masses or discoloration at all. The temperature is warm and dry. His hands aren't clammy at all. I'm going to check his radial pulses, +2, bounding actually, and symmetrical. I'm looking at his fingers, capillary refill, under 2 seconds, and then checking for any clubbing. 160 degree would be the profile sign for that. No clubbing, so that would be respiratory or circulatory problems. Can you squeeze my fingers? That's hand strength. I want you to stick your arms out, and I then want you to lift your wrists up, your hands up, and then point down, and then like in a circular motion. Perfect. Okay, cool. And then I want you to make a bicep curl. Yeah, there we go. Make a bicep. You have 2 biceps. And then I want you to pull and push and pull and push. Excellent. So that was testing the strength of your elbows and also your arms there too. Lift your arms up as high as they can go over your head, and then you put them a little bit behind your head, and then bring them down to your head, and then kind of try to put them behind your back. You might have to move up forward a little bit. Yeah, okay, good. So he has great range of motion, and his shoulder's probably the best I've seen in a long time. So that's incredible. So from here, I'm just going to want to have you take your shirt off really fast. Excellent, thank you. And now we're taking a look at the anterior and posterior chest. Great time to look at the skin quality and color. Right now, too, I've noticed his breathing is normal. He had a respiratory rate of 14. There's no use of accessory muscles at all. So I'm just going to give his lungs a quick listen. I'll start with posterior lungs. So we're going to run through the 9 different positions. He has a pretty long torso, so we should be able to do this. Just a full breath in for me. And you want to do it in between the scapula and the spinal column. Okay, so I'm going to do the 9 places. We demonstrated the first 2, 6, 7, 8, and then I can actually do 9, 10. So there's a couple different sounds you want to listen to. There's bronchovesicular, so it's going to be even inhalation and exhalation and a more soft tone. And then the vesicular sounds down here in the lower lobes of the lung are going to be shorter inhale and longer exhale and sound more like a wind, like a whoosh. So then moving forward, I want you to lift your left arm up for me. So the left lung only has 2 lobes, so I'm just going to listen to 2 spots under his arm here. Sorry about that. Breathe in. Breathe out, breathe in. Okay, so they're perfectly clear there, and I'm going to do the right lobe as well. Can you lift your right arm? There's 3 lobes on the right lung. So breathe in and out, and then breathe in and out. Awesome. And then we'll move to the front. I'm just going to have to listen to the trachea really quick. Breathe in. Breathe in. Okay, so these are bronchial sounds, very high-pitched. A very long inhale and short exhale. And then we're going to do it again with the anterior here. We're going to listen to the bronchovesicular, and then you would run through the positions and then vesicular too. Excellent, awesome. So we ran through all those. All the lung fields were clear to auscultation. If you can go ahead and relax again, that would be wonderful. Now I'm just going to take a listen to your apical pulse of your heart, okay? So you can count this for 60 seconds. If he has an abnormal rate and rhythm, you definitely want to count. But everything's checking out there. And then we're going to run through the aortic, pulmonic, tricuspid, and mitral valve with the diaphragm. And then you're going to do the same thing with the bell, just to listen to any deeper tones. And you would listen to these longer as well, but just to show you the positioning of them. Okay. And next, I'm going to do a look, listen, and feel assessment of the abdomen. So I'm going to completely lay this down. Going on a little relaxation trip here, brother. And we're going to check from here the contour of the tummy. I do see that it's flat, and it looks like it'll be soft to palpation. And then we're going to check if the left is equal to the right over here, if they're symmetrical. We're also going to be seeing the aortic pulsation right by the xiphoid process. There's a couple different spots to listen to specifically for some vascular sounds. So there's the aorta, and then there's the renal arteries. That's the ones I'll be checking. So the umbilicus, you're taking a look at that. Sorry if that tickled, for any bruising or any redness. But this is the umbilicus. 2 inches up would be the aorta. And you're using the bell, I'm sorry, using the bell, not the diaphragm. And you're just listening again for any bruise. And no bruise. No bruise. And I'm going to listen to the left upper quadrant of your bowel. Bowel sounds are present with the diaphragm. Lower left quadrant, right lower quadrant, right upper quadrant. Bowel sounds are all present. And then we're going to move on to the feel part of the assessment. So we're going to start with a gentle, light palpation, rotary motion, just the entire abdomen. You don't have anything tender, do you? So you want to save tender for last, because it can cause pain and it can cause some problems or anything to move that you want to inspect thoroughly. So nice light palpation of the entire abdomen. Really do a nice thorough check. And then for deep, you want to do 5 to 8 centimeters. I like to interlock my fingers. This really helps to find the organs, if any of them are enlarged, if there's anything that might be missing, like more lumps or masses, distended more, and his bladder down here, he might have to pee, I don't know. Excellent. But that all checked out perfectly, Eric. Thank you very much. I'm going to lift the chair back up for you. Excellent. And then, oh, sorry, just to recap, I lifted up your shoulders, correct?
Yep.
Okay. And then I had you pull my arms. Yes, okay, so we did all the strength testing with your arms as well, just before I moved down to the lower ones. Oh, I'm so sorry. I meant to keep you down because I have to check your legs. It's alright. So right now we're doing range of motion exercises. But before that, we're just going to check the lower extremities. So same thing, we're just looking for skin color, any discoloration, so any venous stasis or arterial arterial insufficiency, checking for edema. There's no trace edema, no pitting at all. Everything looks great. He has good hair and skin color and hair distribution. And then we're going to be checking his feet. His feet are a little bit cold, but that's to be expected. He wasn't wearing any socks or anything. His capillary refill is under 2 seconds. His dorsalis pedal pulses +2 bilaterally. Excellent. And then we're going to do a couple of range of motion exercises too. So can you just make your heels go in a circle and then lift them towards your face and towards the ground, and then I want you to push against my hands. Excellent. And then I want you to push against my hands with your legs and push against my hands with your legs, and then your left leg, hold it up for 5 seconds. Good. Right leg, hold it for 5 seconds. 5 seconds. That's perfect. So if you want to show off, let's see how high you can get your leg up, your left leg. Wow. Jesus, dude. You have NFL punter. Okay, and then I want you to bend your knee, and then that shows us range of motion of your knee, and then flare your hips out. Good. So you have great range of motion in your hips as well. So you can relax your leg. Same with your left leg. And then flare it out. Perfect. Okay, so now I'm going to do Babinski's test on you. So this just is going to check the plantar flexion of your feet. So you go in a nice J motion here. Bam, look at that. Babinski's. Hey, relax, man, don't cheat. Oh, he was just anticipating. I gotta do it again. You usually press pretty hard. You usually use your reflex tool. Oh, man. Ticklish, right?
It feels so weird.
I know, it does. Okay, cool. So that's just part one of the reflex test once you're down. I'll sit you up here, and then I'm going to do another reflex test on you too. So since you're like this, I want to check the reflexes of your quadriceps and then your biceps. So right above the patella and the kneecap, just if you can squeeze your hands like this together, that usually helps relieve tension on the quads. And then you just hit, bam. I don't have my reflex hammer, but this dude is just, wow, Spider-Man. Okay, I want you to take this here, pillow, put your arm on it. You can relax your hands. You don't have to hold them anymore. So what I'm going to do here is I'm going to have you flex. I'm going to hold a little. You're like way too strong. But I feel the tendon there, and then relax your arm. And then that's the tendon. I'm going to hit my fingers, and then his fingers should flare out. Yeah, or flare in. Same side. Wow, you're good. You already know. Flex in, flex out, and then. Ooh, it's kind of hard with the pen. It kind of hurts my hand. Woo! The reflex hammer is way better. I'm not gonna lie. All right, cool. So if I could have you put both your hands up and touch each finger to your thumb at the same time on both hands. Boop, 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 as fast as you can go. That's it? That's all you got? That's all you got in me? Look at that. Come on. Look at them finger typing skills. All right, cool. So you can relax. And then I also want to do another test too. Just touch your nose to my finger.
My nose?
I meant your finger to your nose to my finger. So finger to nose to my finger. Yes. To my finger.
Oh,
and then both sides. Okay.
Oh, like that.
Yes,
Like
yes. Finger to nose to my finger.
That's okay. That's so weird.
Jeez, man, it's okay. You're super hyped up. I'm like super just having so much fun here right now. I'm messing with you. Okay, so that was just another sensory test we can do. I'm gonna move on to the wisp test. This is a very fun test too. So you see this piece of cotton? I'm just gonna wisp it across your body. Let me know if you feel any sensation. Okay. And you close your eyes. Good. I forgot to tell you that. Oh yeah. I don't even know if I'm actually hitting you, but just the thought of that's good. Really good. So that's just showing that your hair follicles are very sensitive. That's good. Okay, cool. And then another test is going to be called the just sharp and dull test. Stick out your hand for me, and I'm going to have you distinguish the sensation between the sharp feel and the dull feel. With your eyes closed, I want you to tell me which one you feel, okay?
Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp.
And then you go all the way across his whole body with this. Bing, bang, boom, straight to the moon. All right, cool. So next, what I'm going to have you do, let's see, did the fingers, did the wisp. Okay, cool. Can I have you stand up? Perfect. Now what I'm going to have you do here is, since you're standing up perfectly, take your right heel, lift it up to your left knee, and drag down. And vice versa. And that's testing his balance. Great balance, Eric. And then I'm going to have you stand still for 20 seconds. Close your eyes. 20 seconds went by. This tests his cerebral function. Same with the last one, cerebellar function, sorry, for balance. Okay, now let's have you go between this beautiful path of weapons and destruction, and then just normal slow gait towards the laundry. And then on your way back, go heel to toe. Excellent, cool. And right now too, I'm also looking at the symmetry of your shoulders and of your spine. Can you turn around for me? Same deal. So shoulders, scapula, lumbar spine, hips, and if you can touch your toes, make sure you don't hit your head on the cymbal unless you like to play the drums with your head. And then we're also looking at symmetry of the left and right side of his back too, for like scoliosis and such. Okay, now stand up. And then also, I'm going to grab your hips, and then I want you to twist to the left without moving your legs. And twist to the right without moving your legs. Face me. I'm going to test the range of motion of your neck. So right ear to right shoulder. I'm sorry, that'd be very impossible. Right ear to left shoulder, right? And then left to left. And then I want you to do chin to chest. And then look up to the sky. And then come normal to me, and then twist your head to your left. And then twist your head to your right. Wonderful. And I'm just going to do a quick recap before I let you go here, Eric. I appreciate your time. I just want to see, we did the general assessment of you. We did your head. We did your eyes. We did your ears. We did your nose. We did your mouth. We did your throat. We also did your neck. We did some of the shoulder range of motion with your upper extremities. We did your posterior anterior chest, which I do see is 2-to-1 ratio as well. I forgot to mention that. That's just for barrel chest if you have any respiratory issues. We also checked your heart, your lungs, your peripheries, your abdomen. We went full through your legs and your feet. We tested the strength of upper and lower extremities and also range of motion of your lower extremities. And we also tested some sensory function as well. So is there any questions that you have for me at all? Nope? Okay, all is well. I'll see you soon, man.
Cool.
Take care.